Welcome back. In this session, we can discuss how do we build a cognitive healthcare application. We have a lot of things to be discussed under this topic. We will make it minimal, and next session also we will discuss on the same thing so that it won't be difficult for the listeners. It's actually big when you come to healthcare industry. It is a very large and a complex ecosystem that has many types of organizations which come into picture. The ecosystem is really very broad with several well-defined people contributing to it, organizations coming into it. There are many well-defined roles coming into picture, which include healthcare providers, healthcare payers, medical device manufacturers, pharmaceutical firms, independent research labs, health information providers, and finally, last but not the least, government regulatory agencies. There are enormous advancements in the area of medical, technical advancements in the area of medical, and they have enabled the organizations to improve the results and outcomes. But there is still a strong need for medical society and the medical things are to improve. There is still a very strong need for the sector to improve by itself. So technological advancements can ever go on with a very huge demand from the medical side to contribute to it. So pharmaceutical, medical, and related allied domains can all make use of cognitive computing, and that's going to really pay nice results. Well, foundations of cognitive computing for healthcare is to be discussed now. The healthcare ecosystem fundamentally creates and manages a large volume of data. The data could be digital images from the CT scans, MRIs, medical devices report, patient medical records, clinical trial runs, billing records, and whatnot. We have got a huge amount of data, voluminous data, which are all including whatever I said, and that is what is building the healthcare ecosystem. The data exists in different formats. It can be from a simple manual paper records and spreadsheets to unstructured to structured, streaming data format, and variety of formats are there because different systems are being used for different purposes. And the point is to be understood here. We are generating data from different systems, and hence obviously the format of the data would be different. Some of them could be structured, some of them could be unstructured, and we can't do much about it. We have to handle it. So it is very complex. It's not so easy to go ahead with it. Right. Now, some of these systems are very well integrated, but many of them have not been integrated is the point that we need to understand. Right? The vast amount of data generated and analyzed by the healthcare industry presents significant challenges. There are a lot of challenges which are connected to this. But organizations always connect and find out new ways to manage and to share this data, and they are finding that there are amazing opportunities to improve the health outcomes. So end of the day, it has to provide excellent results to the one who is facing problem because of these health issues, and he should be provided with nice results, and technology should come and favor that. The healthcare providers have implemented electronic medical record. We are using it even in our country to a huge extent now. Electronic medical record EMR to maintain the integrated, consistent, and accurate patient records that can be shared by a medical team. EMR is still a work in progress for many organizations and many countries, but there is a huge potential for it to grow. The benefits are really complete, accurate, and up-to-date data can be available there, which can be used for further analysis. The treatment decisions can be made much more faster, much more confidently, with greater speed if the medical information is available in the digitized form, which is also in the consistent format. Now, one of the persistent challenges for the healthcare organization is that need to find the pattern and outliers in both the structured and unstructured data that can help them improve the patient care. Now, please see the picture which is presented to you. The data management in the healthcare ecosystem is changing. The trend is changing. It is moving away from document-centric silos to well-integrated knowledge bases that could include both structured and unstructured data. It is moving away from the document-centric approach to mostly knowledge-centric approach, where it's going to be much more useful for us, and that's going to help us out in understanding things better and to arrive at a conclusion better so that we can treat people better. The management of the healthcare data will begin to follow much more standardized approach. It will be more of standard based approach to facilitate sharing of data whenever appropriate. So please remember this point. It's going to go more standards based. Medical devices and sensors have the capacity to generate a real large amount of valuable data about a patient's condition, but this data may not be captured effectively all the time. There are great opportunities to improve screening of patients and anticipate changes in their medical condition by using predictive analytics on the data streams. So that will help us in understanding and anticipating the changes. The cognitive system can capture and integrate this new generation of sensor-based data with entire recorded history of medical research and clinical outcomes captured in natural language text to form a corpus. Please understand this point. Cognitive systems will have a real huge role to play here, and it can enhance, it can improve the process to the next level. The system learns from experiences with the corpus, enabling excellent improvements in the outcomes. The doctors can really get a digital reading on the respiratory rates, heart rates, blood pressure, blood oxygen saturation, and can monitor vital signs for the patients all in real time, and they can detect the conditions. And all these in real time is the point that I would like to stress and give a pass there, so that we can understand that the doctors get everything real time, accurately, as well as it is going to help us out in understanding the patient's conditions much better. Now, what are all the constituents in the healthcare ecosystem? This is a real huge topic that we need to understand. There are so many things which come into picture when you talk about the healthcare ecosystem. The healthcare ecosystem has evolved tremendously. It has evolved really nice, and it includes variety of organizations, each of which contribute to the development, our financing, our delivery, our treatment information, processes, products. You can see that all these are presented in the picture for you, where you can see healthcare providers, payers, pharmaceutical companies, independent research group, data service providers, medical instrument manufacturers, equipment manufacturers, all have access to different sources of relevant healthcare data. Now, government agencies cannot be ignored, and even the government agencies have got a clear role in managing who sees the data. Some of this data are shared, but much of these are really very critical, and it cannot be shared to everybody, and they come under regulations which are to be properly monitored. And now we have used a term, we have used series of terms here which are very important for us to understand. That's what I'm going to talk about. You can see that there is something called as patient here. What is patients? Very simple. The data managed and leveraged by different constituents in the healthcare ecosystem include whatever the details provided in front of you as patients, providers, pharmaceutical companies, and payers, government agencies, data service providers. All these are the constituents. Now we need to understand their role and what is that they do. The patients, for example, from the family history and habits to test results, individuals participating in the healthcare ecosystem produce personally identifiable information which may be aggregated anonymously where permitted to guide care for those with similar attributes. This is to be understood clearly. And when it comes to providers, the data covers a broad range of unstructured and structured sources. Some examples which can be referred here include patient medical records, data from sensors and medical devices, intake records from the hospital, medical textbooks, journal articles, clinical research articles, regulatory reports, building data and operational expense data. All this will come into picture under the providers. Pharmaceutical companies on the other side is to be discussed as well. The data to support pharmaceutical research, clinical trials, drug effectiveness importantly, competitive data and drug prescriptions by medical providers all will come under the pharmaceutical companies. And now the very important thing on the other side has to be discussed. Payers, the data includes billing data and utilization review data as well. And when you come to government agencies, regulatory data is what is most important. And data service providers, prescription drug usage, effectiveness of data, healthcare terminology taxonomies, and software solutions to analyze healthcare data all will come into picture. So you can understand that these are all the constituents of healthcare ecosystem that we see. And it's going to be a great role that cognitive computing will play in improving the current healthcare standards, the current healthcare solutions, and overall it will benefit all of us. Thank you, and we will see more in the next session.